Shall I make a start, Larissa?
Yes, please.
Yeah. Okay, my name is Geraint Davies, MP. I chair the All-Party Parliamentary Group on Air Pollution. I was very pleased to open this Clean Air Day special meeting with star-studded guest lists for you to enjoy. Just a few words from me, really. Our focus has been in recent times, quite rightly, on the Environment Bill and the need to bring in World Health Organization air quality limits 10 micrograms per cubic meter for PM 2.5, and we'll continue to press on that alongside better localized measurements and more doctors and clinicians to help ensure all our doctors are giving warnings about the problems of air pollution and the links to people's health, in particular their lungs and their brains and their hearts, of course, mental and physical health as well. And most recently, there's been resistance, of course, from the government to set specific limits. And it's important that we sort of focus in on the most toxic PM 2.5 as well. The last APPG meeting I did, in fact, was this week with Extinction Rebellion, and there was a focus there on the problem of incinerators. Again, this is something we want to watch because the current plan from the government, having sort of increased by 50% the amount of incineration, is planning to increase massively the number of incinerators by 2030, by something like 50 incinerators on a base of something like 90. This is a great concern, and obviously we need a tax system that doesn't encourage that. And there's a lot of emerging evidence, in fact, whether it's from studying children's toenails in terms of heavy metals or egg productions up to 5 kilometers away from these incinerators, to show that there's contamination coming through the body system and affecting human health in terms of air pollution. So I only mention that in passing, but obviously many of these problems would be solved if we did have a legally binding World Health Organization limits, and therefore it would be there for the government to have strategies, whether they're fiscal or regulatory or otherwise, to actually deliver those to ensure we get better human health. But without further ado, I want to hand over now to Director of Global Action Plan, Larissa Lockwood. Over to you, Larissa.
Thank you, Geraint. Yes, it is Clean Air Day 2021, so the annual rallying moment to bring attention to air pollution, the invisible killer, and to encourage everyone to do something to reduce air pollution and to support and call for more urgent action to save children's lives. So at Global Action Plan, we coordinate the campaign, but we obviously don't do all the amazing things that are happening today. So I just wanted to say a really big thank you to all our partners and supporters, and you on the call today for what you're doing today and on other days to tackle air pollution. I've woken up this morning to a very early BBC interview and a Twitter feed full of clean air activities and events going on across the country, which is really just so heartening, even with such a serious topic. And it shows that there is a public mandate for action. The vast majority of people, or 94% of us in our latest polling, think that action on air pollution should be a priority for the UK. And people think that this is more important than smoking, healthy eating, and even fixing potholes. And that's across political parties. So let's crack on with it. We urgently need to, as our clean air data today shows, 1 in 4 children across the UK are breathing dangerously high levels of air pollution in school. So that's levels over World Health Organization limits. So that's over 3 million children. And this is clearly going to be damaging their health, such as triggering and causing asthma, and reducing their ability to learn by impairing their memory. And as we know, dirty air can kill, as we've seen in the case of Ella Deborah. So this really is, it's not acceptable. So every time we get in a car, order a delivery, light our barbecue or log burner, we need to think about those children's lives that are at stake. Because air pollution is solvable and we can do something about it. We really had a glimpse of that clean air future last year when we all stopped driving our cars. You know, the air smelt so much better. You could hear the birds sing, have a chat with your neighbor across the street, and it felt safe to walk, cycle and play in the street. And air pollution was lower, 20 to 30% lower across the UK, and it even halved in places. And that was because we changed our behaviour. So let's make it easier to do those things every day. We need investment in walking, cycling, public transport. We need employers to stick with flexible working. And we need measures in place to protect children at school. So we need these healthy national air quality targets and the support to meet them. And we need local measures around schools so that there are fewer vehicles and cleaner vehicles on the road. So things like school streets, park and strides, safe walking routes to school. Air pollution is solvable. And that is what I love about Clean Air Day, because there are literally hundreds of organizations and thousands of people up and down the country today doing something positive to tackle air pollution. Just have a look at the hashtag Clean Air Day for some inspiration. So there are schools doing assemblies, lessons, walk to school days. I just saw on Twitter some children in North London protesting on their way to school, calling for cleaner air. In Glasgow, they're taking children's artwork and beaming it on some of the iconic buildings in the city centre. Councils are getting involved. Birmingham have an air pollution art installation in the city to link with the launch of their Clean Air Zone. Transport for Greater Manchester have been running an amazing social media video campaign to inspire action. There's some really cute videos of children. There's a lovely one in Bolton with kids telling us to walk to school because it's so much better for us. And hospitals are playing their part. So Guy's and St Thomas's are doing no idling training with their ambulance fleet today. Great Ormond Street Hospital are training their staff about air pollution so they can give advice to patients. And we know of at least 20 businesses, and I'm sure there's even more, doing clean air activities such as sustainable travel events for staff, trials of e-bikes, bikers' breakfasts, and others are launching public commitments to address the air pollution that they create. Excuse me, because this is everybody's problem, and we all have a part to play in the solution, some more than others, which is why I'm really excited about this discussion today and hope that the policymakers listening, as well as everyone else, will show your support for children's health by leaving the car at home and supporting home delivery services that are low and zero carbon. And of course, share what you're doing on hashtag Clean Air Day to inspire others, but also use your voice to support local action to protect children's health in your constituency, whether it's school streets, cycle paths, or zero emission buses, and within Parliament to ensure that an adequate policy framework and support is in place to enable a clean air future for the UK. We really have a massive moment for change right now coming out of this pandemic. So let's build back cleaner air. Let's use it. Thank you, and have a great Clean Air Day.
That's fantastic. Thank you so much, Larissa. And that reminds us, amongst other things, that wood burning is an increasing problem. Something like 38% of PM 2.5 is caused by wood burning and incinerators. In fact, in London, it's got the greatest rate of incineration of anywhere in the country, 54%. And again, we want to tax the fiscal system. Either we want to ban wood burning, it seems to me, or to tax wood burning, because wood, of course, is a natural way of storing carbon, so we shouldn't be burning it in any case. Our next speaker will be Destiny Boca-Batessa, who is, in fact, is 18 years old, co-founder of Choked Up. And I'll be inviting, great pleasure, Destiny, to speak in a moment. And there's been a lot of studies already that shows that the impact of clean air hits more diverse communities and poorer communities more. And again, I know I keep on going on about incinerators today, but the plan for incinerators is to put them into more poorer and diverse areas. And this is appalling that those with less money basically have greater problems with air pollution, greater suffering, and they cause, of course, much less of it because they drive around less in general. But without further ado, over to you, Destiny. We're looking forward to hearing from you, Destiny.
Good morning. Happy Clean Air Day, and I'm so grateful to be in this space and to be able to talk about something that I feel so passionately about. So here is a little presentation about our campaign, Choked Up, and why we campaign for more than just clean air. So again, to introduce ourselves, who are we? Choked Up are a group of Black and brown teenagers campaigning for better air quality in our most vulnerable, i.e. our BAME communities. And our biggest goal is to be able to enshrine Black and brown lives in UK clean air law. This drive and passion comes from the fact that we've all lived in areas worst affected by air pollution, and so we've seen firsthand its dire impact on our communities. when we talk about climate justice and air pollution, and I guess to talk about good air quality, something that I feel really strongly about is that it coincides or goes hand in hand with social justice. But again, what does that even mean? So we primarily campaign for clean air, but we also bring to light so many other intersecting issues, such as race and class, which all need to be addressed in the fight for social justice. A key word in this is environmental racism, which discusses the fact that people of colour in the global north and the global south as a whole are burdened with the worst impacts of climate change, which all directly impacts our health. And yet we are the least responsible for doing this, and yet it is the global north and I guess the richest who are responsible for creating and perpetuating this tragedy, and yet are least likely to be impacted by the climate crisis. In practice, what does this mean also? So this is expressed through the gross negligence of our government in protecting its most vulnerable communities, especially in London. Again, our communities consisting of high BAME and working class populations always end up at the receiving end of breathing toxic air and other health impacts that coincide with air pollution. And yet our voices and our narratives and our struggles are constantly being swept under the carpet. And this is something that is simply unfair. And we at Choked Up decide that, we're not going to let life happen. And we know that we don't deserve to live a reality where things beyond our control are already directly impacting our quality of lives. And yet, we're only children and students and teenagers. And this is just something that's completely absurd. Our campaign action that we did a couple of months ago regarding the road signs that we created and we put up in streets such as Whitechapel, Brixton and Lewisham, further highlight the fact that it is communities of colour and that are again disproportionately affected by air pollution, where we called our future mayor in question to really tackle these issues seriously and take initiative of the air pollution problem in London. So although there's a lot of, I guess, tragedy and a lot of unfortunateness that comes with the fact that we live in such highly polluting areas, on the flip side, we can definitely be able to act on this. And I guess the first thing that people think is, what individual actions can we take? Do we drive less, invest more in public transport and stuff like that? But in my eyes, for more radical change to take place, thorough action needs to follow through, which comes in multiple forms. So the first thing I would say is to be able to listen and to be able to network with others. I strongly believe in, people power, and that it's really, really important to mobilize people to a cause that you really, really care about. I know that there are loads of organisations that are sort of working on the air pollution problem within, different constituencies and different communities, and to be able to come together in solidarity to a common cause is something that's really, really important, because you can connect with like-minded people on a more personal and an interpersonal level, and so you've got that collectivism already established, which is great. To be able to take this further, I would also say call on those who represent you and your needs. So a great example would be your community leaders and your MPs, especially because they're obligated to listen and act on your concerns, because they are your constituents and it's quite literally their job to. And they are also the voices that represent you and me in bigger conversations and spaces such as Parliament. So to me, it's always been essential to be able to establish that working relationship, but also a personal relationship, ensuring that they represent our issues in the most accurate way possible. And so communication really, really matters here. It's always important to mention that your own individual needs are valued and they are really, really important. Other ways you can support Choked Up directly is the fact that we have social media, so be sure to follow us on Twitter and Instagram. And should you wish to contact us directly, for example, if you have an action or any ideas that you'd like to brainstorm with us, we have an email as well. We are chokedup@gmail.com, and we'd love to be able to, I guess, broaden and create stronger relationships with people that also share the same passion that we do. And so this is only the start of the radical change that we will be able to make in the future. And thank you so, so much for having me. I've really appreciated speaking amongst this space. Thank you.
Right, that was absolutely brilliant, Destiny. Thanks so much for that. It's fantastic. And obviously the issue, as you framed it, of environmental racism is massive. And it might be worth adding that the latest research, of course, on coronavirus shows that in areas of higher pollution, You know, there's something in the order of 10% extra deaths and this extra infection. This is work done by Harvard and Max Planck Institute in Germany and around the world. And of course, because communities of colour are more likely to be in polluted areas, that is a contributory factor to their disproportionate death rate from coronavirus, as is the fact they tend to be more likely to be in people-facing jobs rather than working at home on a computer. And again, we need to confront what, in essence, is environmental and structural racism in terms of our public health. So thank you so much, Destiny. And of course, again, I know I keep on going on about this, but there's a campaign about stopping the Edmonton incinerator. I think we all, you know, the idea that everything's going to go gradually better is false. Things are getting worse, and they're hitting the people most vulnerable hardest, and we need to act and not let the government off the hook, in particular on the enforcement of World Health Organization air quality standards. So thank you, Destiny, it's fantastic. Now over to Professor Stephen Holgate, who's our great national expert on air quality. Great pleasure, as always, to welcome you, Stephen. Over to you.
Thank you very much, and welcome to everybody on Clean Air Day, and thank you very much indeed for inviting me this morning. I mean, we're at a unique time really in our ability, I think, to engineer change to protect human health. And I think the arguments that have now bubbled to the surface and beautifully expressed by Destiny, and I'm sure will be expressed by Rosamund in a minute too, is the fact that health, human health, is now coming to the forefront of the discussion, as opposed to just meeting air quality limits set by some distant government organization. In other words, it's human beings, human lives, quality of life, inequalities, as we've heard about, and the most vulnerable that are being brought to the forefront of the discussion. And I'm really delighted that Larissa and the Global Action Plan have chosen children really as a sort of bit of a focus for today's activities, because of course children are amongst the most vulnerable, and they're most vulnerable for a number of reasons, not least of which is that their organs are still developing up until the child actually reaches 18 years of age. Air pollution coming largely from human activity and mostly from burning in one form or another, whether it's through vehicle burning diesel fuel, or whether it's burning coal or burning wood. It is the chemicals that come off from that process that are the most toxic of the pollutants that we encounter in the atmosphere. There are other sources, but these are less toxic. And so it's the human generation of these pollutants that is causing the issue. And particles, nitrogen dioxide, volatile organic chemicals, ozone, these are the chemical mixtures that we associate with poor health. And this starts at the time of fertility. And two very large studies, one in Southeast Asia and one in America, has shown that air pollution reduces fertility by about 20%. And it does this in two ways, operating by decreasing the viability of the sperm, which of course is the male side of the equation, and decreasing the maturation of fertile eggs, which are capable of forming a fetus. And bringing those two things together, of course, means that you have quite a marked interactive effect on reducing fertility, which is dropping off year on year in this country, if you look at the statistics. Secondly, once the baby's formed, it grows much more slowly. So there's very good data, both in London, other parts of the UK and around the world, that air pollution generates premature birth and low birth weight. In other words, the rate at which a child grows inside the uterus is impaired, not by any one pollutant, by all the pollutants that we emit by burning in one form or another. And estimates in London, for example, suggest that premature birth and low birth weight could be improved by up to 15% if we cleaned up the air to World Health Organization levels, with 3 100 to 350 babies born of normal weight who otherwise would be underweight and therefore greatly disadvantaged. And within the developing baby, air pollution, which is capable now of crossing the placenta into the baby's circulation, has three big effects apart from other lesser effects. The first is that it slows the development and the maturation of the lung. And babies that are born in highly polluted areas, for example in London, would be born with missing 3 generations of their airways out of the 23 generations of the airways that are formed when a fully developed lung grows. And this impairment of lung function or lung growth reflects right the way through then the child's life into adulthood. And even by the time of 18 years of age, children still who are born in polluted areas still have impaired lung function, and as a result of this are at risk of lung disease. That is infections caused by viruses, like we've just been experiencing this last 18 months, but also other diseases like bronchial asthma and chronic obstructive pulmonary disease. So pollution has a lifetime effect that started off in the uterus as the lung grows and accumulates over the lifetime of the person's exposure. The second is the effect of air pollution on the developing cardiovascular system and heart. And it's now been definitively shown in many studies that early life exposure of a pregnant woman or a child to air pollution accelerates their development of hypertension and chronic heart disease later on, which clearly is serious. But probably one of the most worrying, more recent aspects is the effect of air pollution on how the brain develops. And it's been shown in, again, a number of studies over the last 2 or 3 years that air pollution exposure early in life reduces the white matter, which is present in the developing brain, and it's where all our mental networks are built up, reduces the connectivity of those networks within the human brain. And functionally, this has an effect on IQ and on cognition, the ability to be able to think and reason properly. And these effects, again, stretch into childhood, schooling, and then into early adulthood and beyond. Because once the damage is done, it can't be repaired. These things can't be reversed. So I think the conclusion I've come to is that we've got to clean up the air desperately, urgently, because the future generation that we've all been hearing about today are totally dependent on us doing this if we're going to get proper human health gained from having air to breathe, which is clean, just as we have water to drink that is clean. And here, as Destiny so correctly says, there's a human injustice here and a human right that we deserve to have clean air, and we must fight for that above all else. Thank you.
Well, that was truly fantastic, Stephen. Massively informative and inspirational, and reminds us, of the real costs that we face, and we're basically drifting forward into worse and worse health outcomes that are lifelong and massively affect us all. So this is a call for action. And like Destiny, we're calling for people on clean air to not just say we care about clean air, but for governments actually to, basically clamp down on wood burning, diesel burning, combustion generally, and in particular, and as I've already said, many times, incineration as well in our cities. But without further ado, I'd like now to invite our good friend Rosamond Kissi-Debrah to again remind us of some of the appalling impacts and the imperative of political and behavioural change to provide a better future. Over to you, Rosamond.
Hello, morning everyone. Happy Clean Air Day. Yesterday was exactly 6 months to the day that Ella posthumously won her landmark victory. And it feels such a long time ago now because so much has happened. And it's it's a couple of months now since the coroner came out with his recommendations, what needs to happen. And as we speak, I don't know whether the government have made a statement yet, but all the relevant bodies that the coroner wrote to, interestingly enough, they are meant to be responding for today. I won't see it to a further, a bit later on, I don't know, maybe in a few days. And it'll be very interesting to see what the government especially has come up with. And I would like to take this opportunity, as I said, landmark victory. My family and I definitely wouldn't have succeeded without Sir Stephen here, and he's very modest, but without his help and intervention, I don't think we would have got the victory which we did. And I have since been told it is the first one in the world actually that air pollution has gone down on a death certificate. But we all know, don't we, that it can't be just Ella who has died because of this. We know that globally, 8.8 million people, and that is 1 in 5 people all across the world, die prematurely because of air pollution. And I hope Ella's landmark victory will go some way into helping, especially children like her, bringing it to the forefront. I have been in several meetings with the government, and Geraint has been there with me, and we've been pushing, and Sir Stephen, we've been pushing them on the coroner's first recommendation, which is WHO limits. We actually want it enshrined in law. I'm a bit disappointed this morning. Oh, by the way, when you lose a child, no action is ever going to be enough. So people should never take heart if they feel I'm being a bit negative. It just goes with losing her child. So I want action now. And I read this morning that the targets are not going to be ready till October 2022. And what I immediately think of, what about all those children in between that unfortunately will lose their lives? And that's what my campaigning is about, and that's what Ella would want me to do. She would want me to fight for all children so that all children can breathe clean air. And I look back, and this morning we spoke, her siblings and I looked at her life. We don't do it very often, but Clean Air Day is quite significant, and what she would be doing now. And she would have been Destiny's age, be in a sixth form somewhere in Lewisham, no doubt, and enjoying life. But ultimately, the reason why she isn't here is because of where she lived. And I have to clarify a number of wrongs which her siblings have asked me to put correct. That we as a family, we don't live in a deprived area, so we need to correct that. But what it now turns out is, if you live near a busy road or a main road, then unfortunately you are breathing in the fumes for the ongoing lorries day in, day out. The South Circular is one of the busiest roads in the United Kingdom, and the traffic is constant. And it is not up to myself. People normally say to me, what do you think should be done? I feel I have done my bit by going to court, getting this victory. And the coroner has been incredibly clear what needs to be done. So government level, implement WHO targets. For councils all across the country, is for them to put monitors to monitor the air pollution, to raise awareness about the damage air pollution is doing, especially to our young people. And also, I've been pushing the government on a public health campaign, because there's no point just monitoring and the, and no one knows where this information is. We need to be very transparent about what people are breathing in. And I was very sad to wake up this morning. I have had the information for a few days that 25% of schools in London are still in areas of illegal air pollution. And that's very, very sad to read. And as Larissa said, we now all know what clean air is, because we have experienced it. Between March and July last year, during the first lockdown, we could all hear the birds saying the actual mist that is normally over the South Circular disappeared. And we all want that. The question is, how do we get there? And I don't have good news about that. We are going to have to make sacrifices in order to get there. There are too many cars on the road, and by shifting cars around, isn't going to solve it. There are 38 million cars on the road in United Kingdom, and the projection isn't about going down, it's going up. The projection, I've been told, is to 42 million. So no matter what we do, unless we drive less, this problem is going to continue. And Garant has already mentioned wood burning. If I was in charge, I would ban it straight away, but I am not, because even during lockdown, PM didn't go down in this, especially in London, and we need to ask ourselves why. So even with all the clean air, PM was still really, really high. And the sad thing to also keep on reading is that children continue, and I've witnessed it with my own eyes, as people have realized this year a struggle it has been for me to keep my other children out of hospital. And when we go to hospital, there are children there. And obviously, I know straight away when you go into hospital and there's a child on a nebulizer, you know why that child is there. There are too many children still in A&E. And the sad news to report for those who haven't seen it is now children are now on more medication. We can't have a generation of children being brought up on asthma medication. And I will continue to mention this. We have excellent doctors, we have excellent medicine, and yet still up to 12 children in London still die every year. And my concern and my fear and worry is this number is going to go up if we don't do something. And this week alone, we've been yet again told that air pollution and transport is now back to pre-pandemic levels. What are we doing? We keep on talking about clean air. The government need to do their bit. The mayor of London need to do their bit. We need to do our bit. It is in all our interests. 36,000 people die prematurely due to air pollution, and this is not acceptable. And to end, I must say, woke up this morning to hear that the COVID virus is continuing to spread. And one of the things we don't talk about is that COVID is airborne. So with the air quality being as bad as it is, the virus will continue to spread. So this is a warning to government as well, that there is an urgency on, and I urge them on Clean Air Day to do something about it now, not next year. And don't allow Ella to have died in vain for all she suffered. Her life was worth it, and so are all those children who walked on polluted streets this morning to go to school. They do not deserve that. Thank you very much for having me.
Thank you, Rosamond. That's fantastic, as always. A heart-wrenching, personal, insightful analysis of the situation. And as Rosamond has said, I've attended with Stephen a number of meetings with ministers, and I've got to say that, you know, when ministers say, oh, well, that would mean we had to stop wood burning and reduce traffic, and we'll have some, you know, we'll have some enforceable limits by 2022, this is simply not good enough. I think the latest figures show that something like 64,000 people are dying prematurely. And as Rosamond mentioned, I mean, the reality is if your body is already weakened by air pollution, you're more likely to get sick and die from COVID. And we also know that, you know, the speed of infection, because of the ACE2 receptors in the nose and the throat, accentuated by air pollution, you're more likely to pick up coronavirus as well. And this is completely intolerable. And again, as Rosamond said, we need to have measuring devices required by local authorities to inform people who've got children in school or whatever, to say, look, we want action now. And finally, we want a fiscal strategy to ensure it isn't cheap to, I mean, when I went along to my local petrol station, there's huge piles of wood that people buying wood. Well, of course, if we tax wood for burning or banned wood burners, then we could make some progress. We need a situation where it's cheap and available, electrified public transport, so it's not in people's sort of financial interest to keep on sort of polluting their neighbours. And so that enables me to introduce Councillor Adam Harrison, Cabinet Member in Camden on sustainability, to give us a view from the sort of council coalface on what he thinks should be done about measurement and improving so far as we can at local government level our air quality. Over to you, Adam.
Thanks very much. Thanks to all the amazing speakers that came before me. It's been fantastic to be here. Camden was actually, I believe, the first local authority to formally adopt WHO standards insofar as we're able to back in 2018. So I'm really hopeful that the government will soon move to do so for all the reasons we've heard. Essentially, one of the reasons we did that was because there are no safe levels of air pollution. So actually it became a sort of logical step forward to say, actually, we do need to go further. But really also because of the galvanizing impact that making that clear statement has across the organisation and within the borough. And it should lead to exactly the sort of thing I think Geraint just said about ministers' concerns. Yes, it would require you to ban wood burning. It would require people to drive less. That's the whole point. We really need to be ambitious on this now, and we've really waited for too long. I'll just say a bit more about what we went through in Camden, how we designed the policy and why, and the effect it's had. Really, there are kind of three main strands. One is to be very ambitious by adopting those standards. Secondly is to be very involving of people, which I'll say more about. And third is to be highly practical, so that people actually know what they can do in their area to actually improve air quality. So we were the first local authority to adopt those standards, and we worked with King's College London to map out what interventions we could take that would make a difference, and would they get us to WHO levels by 2030. And the positive news was, what we do does make a difference, but you do actually have to make those changes, and they included interventions like reducing the amount of transport on our roads. From there, we designed a clean air action plan, which is very much about bringing communities together. It was really about bringing those who pollute together, actually, with those who are affected by the pollution. So it was community organisations, businesses, local institutions, residents, and often people are in both of those categories at the same time. So it was about having that conversation. From there, we designed a whole suite of actions, including with Great Ormond Street Hospital pledging their hospital clean air framework, John Lewis partnership, making certain pledges about cleaning up their deliveries. And then we also have running alongside that what we call the Clean Air for Camden campaign, which is where you have three really, I think, hopefully accessible and understandable documents for people. So they're divided into Clean Air for My Street, so you can go online, read the leaflet. What can you do for your street? How can you lobby for it to be cleaned up? Clean Air for My Workplace, so actually putting indoor air pollution onto the map and actually giving people ways to raise issues of air pollution at work with their employers. And then Clean Air for My School, so what can schools be doing? What sorts of lesson plans are available for teachers, and how can we encourage students to be really pressing others on this? And then since that time, we've been doing things like extending a traffic order across the borough to combat engine idling, which has been really successful. We've been rolling out school streets and other travel measures. But the point about air pollution from buildings actually does need greater attention. We'll be able to do that by changing the energy sources that buildings are using. And this brings me back to a point I'd like to make about wood burning. Actually, we're in a smoke control area in Camden. We have three issues probably. We have a lack of funding to be able to enforce the impact where it does happen locally, and we think wood burning stoves are going up because they're so popular. We have a lack of power, so it's actually very difficult under the Smoke Control Act. We don't have enough powers, and we do need more of them. But then, as has already been said, huge amounts of the impacts from wood burning come from elsewhere. So there are large numbers of houses across the country that are not on the grid, that currently rely on wood burning and other fossil fuel sources for their energy needs. What we need, as has been suggested, is for the government to make a huge step now to ban wood burning properly in urban areas, give us the powers and funding to be able to deal with it, and then roll out a programme for those houses across the country that are not on the grid, and provide them with air source heat pumps or whatever's appropriate. You would, at a stroke, clean up the air for huge numbers of people in the UK. I'll just say finally something about the coroner's report. At Camden, we have issued our own statements in response to this and pledged a number of actions to show how we are acting on them. Camden was not named in the report, but as Rosamond said, people, children will have died everywhere because of air pollution. So really, I think I would recommend that every local authority be taking a look at this and actually making their own statement in response.
Right, thank you so much for that. And the innovation and forward thinking of Camden is very inspirational. And we need local authorities to be, taking a lead on this. The Environment Bill does, of course, throw the ball at local authorities to a certain extent. And it's important to know both that local authorities can make a real difference, but also there's limits to what they can do, because they don't control the tax on diesel, they don't control nearby motorways, etc. They aren't allowed to tax wood or ban wood burners and such. People can put some more questions in the chat if they like, but what I'm intending to do, we've had a very rich discussion today, and I think what might be helpful is just to very briefly run through our panelists again to say whether they've got any further comments on what we should now do in terms of moving forward. From my point of view, where we are on the Environment Bill is that it's in the House of Lords. The House of Lords will be bringing forward amendments to the House of Commons. I don't know precisely what those will be. I'll be trying to influence them so that they are legally enforceable World Health Organization limits, requirement to do detailed measurement at a localized granular level, and also an attempt to get the medical profession to be highly trained and informative of constituents about what the dangers are. These, in essence, are the recommendations that were mentioned by Rosamond, that came from the coroner's Prevention of Future Death report. It's critically important that people lobby their MPs, in particular if they've got Conservative MPs, because there's an 80 Conservative majority. A lot of Conservative MPs, quite rightly, are concerned about air quality. Some of them will have been on the AFRA Select Committee that made some of these recommendations I've just made, and we should be lobbying them to get these changes so that we have legally enforceable change brought in. And finally, people should lobby the Chancellor as well to bring in fiscal measures. But let's have a few final comments then, in the order we had them. So we haven't got much time, but with a view to looking at the chat as well at some of the questions that are coming up, including the good ideas from Rosamond about banning idling outside school and the signage, etc. I'm sure Adam will have something to say about that. Starting with Larissa. Over to you, Larissa.
Thank you, Geraint. And yeah, I'd support everything you say. This being Clean Air Day, it is our moment as a movement. We really can cut through today to a wider audience than normal. Hashtag Clean Air Day is trending on Twitter at #1 already, so we know information's getting out there. So we've got to keep that going and keep putting out on social media what we're doing, but also what we want to happen. So let's call on our decision makers. Let's support the things we like that are happening. There's great stuff going on in Camden. We need to give local decision makers that mandate. So support the local school street, say you like this stuff, but also say what else you want to happen. We've got to keep putting the pressure on because we really need this urgent change.
And Destiny, over you again. A few comments.
Thank you. I was going to say a very similar message. I'll probably say to carry on with the momentum. You know, we've got the statistics, we've got the facts, but to be able to act on them is the other side of the equation. And we're already doing such a good job already with the social media circulation. And if we are, should we be able to continue to keep on pressuring our MPs and pressuring those who are meant to take care of us and those who have the power to actually make radical change, then our goal is so much closer than what we think. And we're doing such a good job already that, you know, there's no need to stop now, and that yeah, change is very, very possible, and we are getting closer to it every day.
Your words are very inspirational, and hopefully will bring forward more and more younger people of greater diversity from all backgrounds, so we have, you know, greater equality and progress. Over to you, Stephen.
Yes, well, thank you. And I have enjoyed this and found it very stimulating. So thank you, everyone. I mean, from my point of view, I'd like the medical and health professions to take more ownership of all of this. They are the trusted messengers to many people who've got diseases. And nurses and doctors are fantastic at delivering messages. So I think with what Rosamund says and with the Royal Colleges issuing their educational initiatives, which is fantastic, we need to really now get some champions in all of our areas that are coming from the health and medical community to start rising up as they did for tobacco smoking and say that the time has come now to get change, and that change cannot be deferred any longer.
Thank you, fantastic. And I'm going to call on Rosamund. And of course, Rosamund is a World Health Organization ambassador, and we're approaching COP26. And what better opportunity would this be for the United Kingdom to be sort of, you know, a global leader, but to say, look, we are the first government to introduce legally binding World Health Organization air quality limits, given that 7 million people die prematurely globally from air pollution. And it's, you know, the twin monster alongside climate change caused by fossil fuels. Rosamund, what have you got to say?
Because in the UK, 1.1 million children have asthma. It is the number one reason before COVID came why children would have time off school. And around the country, up to between 22 and 24 children die every year from asthma. The group which it hits the most is 13 to 15 years old of age. Can you imagine that? Teenagers. My goal remains the same. It won't change. No child should die from asthma. And now we know it is linked to air pollution. We need to do everything we can. We shouldn't make things worse. We need to make them better. It's about protecting children from air pollution, not exposing them to even more. And it is never going to be acceptable in my book, no matter what people say. Do not expose children, especially those most vulnerable, to even more air pollution. Children have rights, and we will be fighting for them. Thank you.
That's brilliant. Thank you very much, Rosamund. And there's a few comments in the chat that people can read as well. But I mean, people are aware now that there's problems of other sorts of particulates. Wood is a big problem, as we've already mentioned. Incinerators is a growing problem. There are issues around brakes as well, and tires. Obviously less with brakes with electric cars because they aren't friction brakes. They're often electromagnetic braking. But these are all issues that we need to look at. Adam, have you got some final thoughts about what we can do in particular, you know, locally?
I would really second what Stephen said. Actually, I think it's so important to have more medical professionals vocalising this. We tried to do this in Camden, where, you know, our three main trusts, the Royal Free, UCH and Great Ormond Street, three of the main trusts, are working closely with us. But I think between them, between councils' public health teams, could also be playing a greater role to be joining up the dots between all the different pieces of public policy and really kind of drive, you know, saying that we need to be taking action now. And then I'd also say, Destiny mentioned about MPs and so on. You know, do write to MPs, councillors, do turn up at their surgeries when they're allowed again, because it does make a difference. Because we're dealing with so many things, it can be hard to, you know, concentrate sometimes. but also because there are so many people who do need winning over still, and they need to be able to, when asked what are you doing on air pollution, what are you doing for children's health affected by air pollution, they need to be able to answer that, and if they can't, then they need to go back to the council and design a better policy.
Excellent, and the battle goes on. Now, I've mentioned the Environment Bill on a number of occasions, and it's important people write into their MPs and say we want to change the Environment Bill to bring in World Health Organization air quality standards. And it's important people write to their local newspapers and just keep the noise and the drum beating louder and louder, because there is an attempt for the government, frankly, to say, oh, we're doing something, and they are doing something, and don't worry, it'll be all right. And then the media machine will move on to the next focal point. But we do need to keep on keeping on. We need to get the as best outcomes we can from the Environment Bill. But obviously, we need a Clean Air Act, and we need to keep on talking about these issues. And again, the next point, the milestone, if you like, will be COP26. But that won't be the end of it, because these problems go on. And I would encourage people to get involved in local campaigns like Destiny's and others. I had a meeting with Extinction Rebellion earlier this week. This is all our responsibility to influence all the decision makers to make the right decisions and not just carry on as we are, literally sort of killing people as well as killing the planet at the same time. I think we've had a great meeting. We've got 5 minutes left. I think we're probably, unless anyone's from the panel's got anything burning to say, I mean, I don't need to use the word wrongly here, but obviously we want to put out the burning. But can I just, on behalf of everyone here, again, just encourage everybody in this room, and I know there's 123 people in this room, to speak to 3 or 4 people today, to go out today on Clean Air and talk about clean air, talk about these issues. Ask people, what do you care about clean air? And they'll say, oh yeah, I suppose so. What are you doing about it? Are you going to write, in the cafe, wherever you are, or with your neighbours or your family? Are you going to do? Will you now write a letter to your friends, or will you tweet something? Will you do something on your Facebook, about, let's take action. I've been at this meeting. We've heard from all this expert panel, people are dying. This is preventable. Let's do something about it. We need to keep this wave going, not just today, but sort of every day, but ask people what they're doing, get them to do something, nag them, and get things changed. I'll leave it there, but it's been a great pleasure to have all these great speakers here today. There will be other meetings. There's another meeting Barry Sherman's doing at 10, in fact, about a clean air dashboard to give people information on how dirty is your own constituency. And you should be talking to your own local authorities about providing monitors and taking action as well. So I think I'm going to leave it there, Larissa. So thank you, Larissa. Thank you so much, Destiny. Stephen, as always, Rosamond, fantastic, and Adam. And I think I'm going to say goodbye to everyone. Have a lovely Clean Air Day. Keep the flag flying and in cleaner and cleaner air. Thank you so much. See you all again. Yeah.